Welcome to Revolutionizing Care, the podcast where we break down how technology, insight, and human-centered design are reshaping healthcare from the inside out. I'm Jeff.
And I'm Mark. Today, we're going to dive into some powerful examples of the healthcare revolution, changes that are actually happening in healthcare right now. We're talking about real-world examples, not just theory.
Exactly right, Mark. So if you're a healthcare leader, a clinician, an innovator, or just someone who's tired of the status quo, stay with me. These examples will challenge how you think about care delivery and show you what's possible.
So, Jeff, given your background in healthcare and technology, I think I'd like to kick it off with one of the biggest shifts that I see in healthcare, and that's artificial intelligence and its applications. And to me, we're not talking about, replacing the caregivers, the doctors and the nurses with AI. In my mind, we're talking about amplifying the accuracy of the information that we provide them to help them do their jobs.
Yeah, this is the obvious first topic. You're exactly right. AI is moving into the healthcare industry. A great example, it's been around for a while actually, is how AI is helping radiologists, and it's almost like a backstop type of technology that's in place where it can help them catch signs of disease earlier, cancers, stroke, with fewer errors. There were interesting articles going around about how IBM Watson and some of the early AI models had actually sat for the radiology exams and were able to pass. But that's really leaning into tech because technology people will know that's just computer vision. And it's ones and zeros, right? It's black and white, it's an image, and it's an easily trainable model. I think, Mark, maybe just a couple more minutes on the rise of AI in healthcare. We're starting to see big organizations take note. Over the weekend, I saw an article where NHS, over in Europe, they have sent out a priority notification, and it's about AI scribes. And basically what they're saying is those are going to be considered medical devices. So when we hear about pushback from healthcare leaders or the thought leaders or CEOs of companies or governmental leadership, it's not the pushback against the AI. I think it's the pushback on, are we ready yet? Do we have the right guardrails? And do we have the governance models in place so that we all understand which bodies of knowledge are appropriate and right to train these models?
I think that's exactly right. And again, the emphasis being the AI is there as a support mechanism for the professionals to, combat the realities of all the healthcare professionals I've talked to who are overworked, right? Staffing's lower than it's ever been. The demand is higher than it's ever been. And so if we can find ways to leverage AI to support them and keep them from getting fatigue and allow them to do their job better, faster, those seem like the implementations that are ripe right now, given everything that's going on in healthcare.
Yeah, I think those are the ones that are going to get implemented and adopted quicker. If we let AI help on the productivity front of healthcare and allow our oversight committees and governance groups and the standards committees to allow the AI to come in for diagnosis or treatment on a prescribed pathway, everybody's going to feel more comfortable about that kind of AI coming in. But you are missing the boat if you're not using it today for administrative, back office, productivity items. Still may be related to the patient chart, but huge value to be had today. And sure hope people aren't throwing the baby out with the bathwater when they hear AI in healthcare and they start thinking the computer is going to start diagnosing the patient and taking the doctor out of the room.
Yeah, that's just not going to work. Okay, so we got to move to item number 2 here.
Yep. All right. So next up, personalized medicine. We've been seeing it in action for years. Oncology, the personalized cocktail of chemotherapy that's used in a cancer patient, but it's getting much broader and real thanks to the genomics and how those tests are becoming more approachable from a cost perspective.
I was at my chiropractor, and he's starting to look at nutrition and go beyond his traditional chiropractic practice. It all gets back to these new concepts and blurring of what I would call the traditional service lines.
If you look at the lineage on this, I think everybody could point to companies like 23andMe. They really kind of opened the door there. Maybe even Ancestry before that, where they were just looking at your genetics, your DNA to tell you about where your family tree, what it looked like, and where you came from. But now it's clinical grade genomics, and layered with AI, that's really rewriting the whole prevention playbook. We're hearing more and more patients say, I know I can't fix the underlying problem because it's in my DNA, but can I get a quality of life boost?
Yeah,
And this is amazing for those kinds of people.
what is interesting to me is there's more and more companies out there doing the genetic tests, and that might be driving the cost of genetic tests down. And you combine that with AI becoming better, faster, stronger, more AI type products that are out there. Am I thinking about that right?
Yeah, volume is creating all kinds of opportunities, but it's also creating more awareness, and some of that awareness can be negative at first. I know that there are lots of people that are worried about physician being taken out of the room, and that's not, and in my opinion, that's not the role of AI in 2025. Will we get there? I absolutely think we will. Mark, it's interesting how your personalized medicine, it when I first heard the terms, I was working at Baylor Healthcare in Dallas, Texas, and the chief of pathology was a guy that was really out there on the bleeding edge and getting into personalized medicine, and it was all around oncology. And I look at it today, and I look at the ability for me to get my family some genomic testing done to understand, oh, hey, Jeff, your body doesn't metabolize lisinopril correctly or efficiently. You should be on this other med instead of that one. Those are game changers. It sounds so small, but those are game changers. And that's the kind of AI and healthcare intersection that I think consumers and physicians can get behind.
Yeah, and I think as the cost continues to go down and awareness goes up, traditional doctors who are used to doing the things the way that they've always done them, if they started getting AI notes that said, hey, for this person, consider a different prescription, right?
Yeah.
That can only be seen as helpful to the doctor, right? And so hopefully we'll start seeing proactive use of the information. And to me, it feels like there are so many different sources of what's good and bad from a genetics perspective, that AI is going to be the only way for providers to keep up with what's the latest, what is the best recommendation based on all the research that's going on all around the world.
Yeah, we're going to have a whole show on this topic. It's moving so fast, and the benefits are so vast that we'll dig into this more and more in future episodes. But kind of moving us along, Mark, I think the next revolution that we've seen that we wanted to talk about briefly today was just the care moving out of the four walls, care moving home. And the subtitle under that would be The Patients Love It. It's that shift from the hospital to the home, and it's massive. The pandemic really accelerated it. The tech existed, but the need didn't exist. And then the pandemic really came in and gave the whole healthcare system some urgency to start embracing the tech that existed today to uh, support clinicians visiting patients in their home.
It to me, it's again, and technology I think plays a little bit of a role because there are more and more remote patient monitoring capabilities. I think I was reading where the big hospitals that we think of as research intensive hospitals, the Mayo Clinics or the Mount Sinai's, and they're implementing hospital at home programs. Some people think it's just a financial thing. It's much better to leave the bed for someone that needs the higher level of care. But I think the research indicates that you actually are seeing better outcomes for certain types of situations, keeping the patients at home. Am I thinking about that right?
Yeah, I would put it in three buckets, Mark. I'd say there's better outcomes, lower costs, and happier patients.
As the ecosystem starts to evolve with more telehealth and virtual care teams and the gig economy where you have roving caregivers, all working together to keep the patients healthier and allowing them to stay at home, that just seems like a natural next step.
Yeah, it's a winner. And AI is going to continue to innovate in that space. I think we'll see the whole care anywhere continue to grow and evolve. And we may see use cases in 6 months that people had never thought about. So, Mark, wrapping up this first show around the revolution, we'll just recap what those three that we talked about today are. Basically, AI is an enhancing technology. It's not replacing. Being used for some diagnosis, but it's more of a assistive technology right now for good reason. We've got to make sure we've got the correct governance and guardrails around it. Number two was genomics and how that's unlocking some true preventative care. And it's not just the worst case scenario patient that's able to get access to or benefit from precision medicine. And then care, moving home. Being able to get the care that you need and deserve and get it with some better results, a better outcome, and be happier about it.
I think each one of these is probably a podcast in the near future. It's amazing how they're happening right now. And so I would just say to folks that are in healthcare leadership, if you're not tackling all three of these, I would tell you you're probably falling behind, because the question isn't if you'll adapt, it's how fast.
Yep, exactly right, Mark. Well, thanks for tuning in to Revolutionizing Care. If you found this episode useful, share it with your network and subscribe for more. You've heard us talk about how we've already got a roadmap of episodes that we're going to talk about. Some of the topics from today we'll just dive in and go a little deeper on. You can always visit us at mlhealth.ai to learn more. Thank you.